Hello and welcome. You're watching FII. I am Sonal Mehrotra Kapoor. Now, while COVID-19 cases in India have come down, flu season is here. Symptoms of common flu very similar to those of COVID-19, cough, fever, diarrhea, etc. Now, with some also questioning if a flu vaccine, that is an influenza vaccine as it's called, will also be the one which is considered. Many doctors recommend that flu vaccine should be administered annually now due to the change in the circulating strains of the viruses. Certain medical bodies like the Indian Academy of Pediatrics and states like Maharashtra have actually recommended flu vaccines for children before 5 years to develop their immunity against them. They've made it mandatory. But now, some doctors have also recommended the same for adults, not just for kids, but an influenza vaccine for adults. However, are flu shots effective? What role does it really play when we are administering it in the environment of COVID-19? How different are these flu vaccines from the COVID jabs? Well, we reached out to several experts to understand more on this, and we got you this explainer. What we have for you today is the top 10 things that you need to know about the flu shot. Thing to remember, number one, they are to be given annually and ideally 2 weeks before the onset of the monsoon or winter. In fact, so you can say between September to February, that's the time really when a lot of us fall sick due to flu. You should take it 2 weeks before that. The WHO in fact collects data from all over the world to pick up the most common strains, and then these vaccines are developed. Number two, the shot takes 2 weeks to generate immunity. It does not lower your natural immunity, however. It's not like steroids. Thing to remember, number three, these vaccines are inactivated virus. By now, at the end of the COVID era, we all know what that means. But it is also quadrant vaccine. That means it solves 4 problems: H1N1, H3N2, and 2 strains of influenza. All this 4-in-1 vaccine is actually available at the cost of 1,500 per shot. In India, of course, and demands are being raised at this point to ensure that these are subsidized considering the times we are living in. Apart from the shot, a live vaccine, a nasal spray, is also been approved this year. That costs a little less, about 800 to 900 rupees. And this should not be used for those who are already on steroid medication, pregnant women, etc., those with HIV, anybody with an organ transplant, etc. All of them should stay away from this live virus vaccine. Number 5 thing to remember, it's near impossible to develop a vaccine for thousands of influenza strains. This, of course, is also something that you know by now. And if there is a virus that is different from those in the vaccine, then the vaccine won't work on it. Also, in the process of making the vaccine, genetic changes may occur in the virus as well. So this is also something that you know by now. Number 6, let's go to that point. Children from 6 months to 5 years must take the shot, say doctors, and the flu shot is not contraindicated in pregnant women. That's good news, and it will in fact give the baby some immunity to flu as well. People with 50 years and above, however, who have chronic illnesses, those on steroids and have had, any organ transplant, same things. If you are immunocompromised, basically, these people also now advised by doctors to take the shot. Number 7 thing, it is 50 to 60% efficacy, and techniques of vaccine making may also impact that efficacy, however. Number 8 thing to remember when it comes about the flu shot, a person may get flu-like symptoms. It might not be flu at all. In fact, the tricky thing here is people might get flu and get COVID, and that's when it gets really complicated. And that's the reason why people are saying take the influenza shot while the cases are down so that it doesn't complicate your situation in case you were to get a bad bout of COVID. Number 9 thing that really is to remember at this point is it's fine for healthy people to take this vaccine as well. However, the best thing to do to try and avoid influenza is actually follow COVID protocols, exactly similar to keeping yourself away from flu as well. It requires a good hand hygiene. If you're sneezing or coughing, follow protocols, use your elbow, don't use your hands, and again, stay away from very crowded places. Which brings me to number 10, which is on everybody's mind, the side effects of these vaccines. In healthy adults, they might experience a muscle ache and at most fever for a day or two. All right, so that's everything you need to know about the influenza vaccine. But why are we even talking about it, and what is making doctors prescribe it more and more? Should you get one? That's the question we'll take with our panel. Joining us on FII today, we've got Dr. Manish Manan with us, Dr. Sushila Kataria is with us, Dr. Vikas Bhutani, and Dr. Ishwar Gilada as well. Let me first begin by giving the first word to Dr. Manish Manan over here. Doc, your first thoughts on why doctors are prescribing it more and more. And I just want to say this right at the onset that this year around, flu was very different from what we've generally experienced or seen in the previous years. I know so many people in Delhi, even in UP, etc., where there is an entire bout of a really bad flu. The fever is higher, the fatigue stays for longer, and it's taking them much longer to recover from flu as well. Many thought, is this got to do with COVID? Is it because this is a long COVID syndrome? Is it because I've taken the vaccine? So could you just clear the air on that? The current flu that we are seeing in the air, is this different from the earlier one? And is that the reason why the influenza vaccine is being talked about?
Thank you. A very important question you have asked. Now, the first thing I want to bring about over here is that we get flu cases every year. You know, about 10 to 11% of total acute respiratory tract infections in children who come to our OPD are influenza cases, and about 7.1% of admitted patients of respiratory tract infections are influenza patients. I'm talking from a publication of 2017. So it's not that it's happening this year. Yes, we are talking a lot about it this year in the backdrop of COVID, because that's, it's on the top of our minds. So hence we are talking about it. Second thing is, kids have been inside for a very long period of time. That also has an impact on the immunity. When they keep getting small bouts of cough, running nose, it has an impact on the immunity. Now, all of a sudden, when they have come out with a low immunity, so the symptoms probably of flu have been more. Thirdly, kids usually used to get vaccinated regularly. The normal MMR vaccines, the typhoid vaccines, the flu shots, which kids used to get, I'm telling you, 2020, we have seen more than 50 to 60% drop in the regular vaccination, which kids used to get and they have not got. So lack of vaccination, lack of immunity, lack of exposure to small minor cold infections, these are one thing. And yes, in the backdrop of COVID, we have become more cautious and we have become more sensitive in trying to pick up these cases and then project it. So
but it's not just in kids, no, Doc. It's not just in kids. In adults, I'm hearing this more and more. And today also what we're trying to understand is an influenza shot important for adults, for healthy adults as well. And we'll sort of break it down into those who got COVID, didn't get COVID. Let me take that to Dr. Sushila there. What are you seeing as a symptom and as a trend this time around in this flu season in your hospital for starters?
This is a time when usually during the monsoon times, we call it tropical fever syndrome. There are 5-6 types of fevers which usually happen. Dengue, chikungunya, malaria are common. Typhoid is another and typhus. But along with this, equal number of influenza patients keep coming always. And so it is a part of the consortium of tropical fever syndrome. Even people have become more aware about adult vaccination, but I have been a very, very strong supporter of adult vaccination even before that. And we always say to our adult patients that you're never too old to get vaccinated. Influenza and pneumonia are two of the primary vaccines for adult vaccination. So even if patients, it may not be a life-threatening situation, but 1% patients can get complicated. More so patients who are already battling chronic diseases, if they get influenza, their chronic disease status gets decompensated. People can have heart failure, they can have worsening of their kidney functions, worsening of their lung functions. So it is very, very important for all adults to have it so that the circulation in the society reduces, but more so important for elderly, smokers, COPD patients, cardiac patients, liver patients and kidney patients. And this should become a standard practice. It should reflexly come to a clinician to advise vaccination whenever any patient who should get comes to them for OPD.
All right. So what I'm hearing from you is you're advocating that even adults should be taking this vaccine, especially in this environment. Interesting point coming in from Dr. Manish was that kids should anyways be getting it. Maharashtra, in fact, has made it mandatory as well in that state. So if you look at that, and let me come to Dr. Bhutani on that one. Dr. Bhutani, then do adults who have taken the COVID shot, is it okay for them to take this vaccine?
Yeah, it's right that one should, this is advisable that one should take COVID shot also in addition to flu vaccine. But the word of caution in this, I would like to say that there should be a difference of at least 2 weeks between the two shots. If one takes an influenza shot today, at least if he's due for a second shot of COVID-19 vaccine, he should wait for at least 2 weeks. Because that's what has been recommended by the CDC organization.
You mean 2 weeks after the second shot, not in the middle at all?
No, not after. You can take it in between also, but only thing is between any two vaccines, there should be a difference of at least 2 weeks when you are taking the COVID vaccine and an influenza vaccine. Yeah.
All right. So, good to know that as well at this point. And what about, Dr. Bhutani, then about people who've actually contracted COVID? Should they be waiting on?
Yes, everyone should be, because the immunity, the antibodies, what we call it, that declines over time in COVID as well as in influenza. Now there are studies to show that the antibodies, people who have received vaccine, COVID vaccine 1 year back, the antibody titers are declining. That's the reason in fact, the United States FDA they started giving boosters to the healthcare of the frontline workers and the healthcare population, and of course even the high-risk population, as Dr. Sushila was talking about, the high-risk population, which we talk of people having so many comorbid illnesses who are at risk from dying of even influenza. Let's not talk about COVID, but they are at risk for dying from even influenza. So influenza can be serious in people who are having comorbid illnesses. So it's all the more important. So they should be also taking, or we should be also prescribing them to take, encourage them to take a flu shot every year, and this year especially.
Right. 2 shots every year. Let me go to Dr. Gilada at this point. Dr. Gilada, then, you know, the fact is all of us are more medically aware as a country now, and in fact as a generation which is actually growing up around COVID. So it's good to get this awareness out there really. But my question really is that, you know, flu protocol, are you today saying that everybody should get it? Are you saying those who are immunocompromised should be the ones prioritized? Because we have limited vaccines. I mean, the end of the show, I don't want everybody watching this to rushing in to get a, influenza vaccine shot. That's not the criteria. And again, I just want to underline, do consult your doctor whether you not need it. This is just, like I always say, FYI. This is for your information. You must consult your doctor before you jump to any conclusion. But Dr. Gilada, what is your prescription to your patients? Do you ask everybody to take it? And which sort of group would you prioritize?
Sonal, as Sushila said, that vaccination in adult was not even heard of earlier. We started in HIV setup in 2010, almost 11 years back. And at that time, vaccination in adult was never heard of. And there are a lot of vaccines which are required for adults. But what happens is, in a country like India, if we talk about current cost of 1450 to 2000 rupees, how many people can afford? Hardly 5% of population. So whenever we make any guideline, we should first make it available in India at affordable cost. Then we should make a guideline. Just having a guideline, asking people to come, rush there. So currently there are only 3 international companies which are marketing in India. Abbott, GSK and Sanofi. And Zydus is away from market. And even Zydus came here, they were also selling the vaccine at the same cost, 1450 rupees also. So everybody had a field day. Whether it's a pneumonia vaccine, HPV vaccine, which prevents cervical cancer, or this vaccine, they're all very expensive. So I think first we should make a good campaign that within a couple of months or so, all our vaccine makers would have exhausted their COVID selling capacity. So at that time, we should start flu vaccine plants everywhere. Unless and until there is an Indian vaccine made in India at affordable cost, we cannot talk about a guideline.
Right.
Secondly, it gives only 80% protection. And thirdly, it's very important for those which are above 50 or 60, those who have COPD, bronchial asthma, tuberculosis, HIV or any other comorbidities to take it, because currently if they get flu, it will be considered COVID. If they land up in hospital, the bills are between 10 to 15 lakhs. So basically,
but does that mean you're asking people to take it as a precaution?
say all vaccines are for precaution. All vaccines are for precaution. And this, and even COVID is a flu. It's called COVID flu basically. And therefore we say flu-like illness is COVID. And therefore we should start getting into that. So SARS is one of the previous infections. So all those vaccines are for prevention. Vaccines are always for prevention. It's called immunoprophylaxis or immunoprevention. So all this, and immunotherapy is after you get a disease, you take vaccine. That also helps to some extent. But these are all preventive vaccines.
All right. So good to get that clarification, but I still want to understand how, why is influenza vaccine getting into news right now, and what is the overlap it has with COVID-19? How should you actually be doing it? That's what we're going to discuss, but on the other side of this very quick break. Stay tuned to FYI. Welcome back. We're discussing all you need to know about the influenza vaccine, and not just for kids, for adults. Why is it so important that we are talking about it in these times? Why are more and more doctors prescribing it? Should you take one as well? Let me go back to Dr. Manish at this point. Dr. Manish, if you could explain very simply to my viewers on what exactly is the overlap here with COVID-19. Now, just for starters, CDC, that is the Center for Disease Control in US, for example, has said that in order to control or to sort of prevent yourself from a very complicated COVID, or to land up in a hospital, or to get a secondary infection, that is, it's good to get your protection from influenza as well, right? But then people would say, well, I've taken the COVID-19 shot, why do I need another shot?
Thank you. So one thing I want to make it very clear, the CDC has very clearly said that the flu shot doesn't prevent COVID. So it's very clear. They say that when you give a flu shot, you at least reduce the burden of flu in the society. When you reduce the burden of flu, already the burden of COVID is there. So you reduce the flu burden in the society. That's the science behind why the CDC has said. However, in this context, since COVID we are talking about, I want to quote two studies. One was from Michigan and Missouri. It's a small study which said that people who have taken the flu shot, their chances of getting the severe disease is less, and chances of getting the disease is also less. Then there was a retrospective study of
COVID-19.
COVID-19, yes. Then there was a retrospective study of about 75,000 patients, which was published on 3rd August 2021 from Miami. The study is from Miami. This study, it found out that people who had got the flu shot, their chances of getting long COVID, like, the complications like stroke, like DVT, like sepsis, that was less. So my concern over here is, this vaccine is, the COVID vaccine is presently not there for kids. So for children, this is the best thing available at the moment now.
I see.
So, at least the flu shot can be given. I'll quote the Michigan study, which says the severity is less, the chances of hospitalization is less. Small study. We need more studies on this.
Of course.
And again, the retrospective study, which says the complications of long COVID is. So there is some scientific data for us to say that, yes, at least for pediatric age group, that's why the CDC has said the flu shot, at least for the next 2 years, I would recommend all should be taken. All children should take it.
Very important points, all of that you've mentioned. I just want to say that everybody on this panel is in agreement that one should take a vaccine. What you're all also saying, and I would like to just go around the table once before we end the program as well. We can start with Dr. Sushila. Just to wrap up points over here, for kids, for older people who have immunocompromised, for them, doctors are prescribing it more and more. For healthy adults, please do consult your doctor. In fact, everybody should consult their doctor before taking it. But for healthy adults, please do see if there is enough availability at one go. Dr. Sushila, how can one get access to these vaccines? You need a prescription by a doctor?
So these vaccines are usually freely available, and most of the clinics, clinics and hospitals are offering through clinic. Most people should consult their doctor and have a prescription before getting it administered, because even if somebody has a special condition, and as you said, the nasal vaccine is not for somebody who has asthma or immune compromised. So prescription and recommendation from the doctor is a good idea, but sometimes one doctor can recommend to a lot of people altogether, going in one area and vaccinating everyone. That is also a cost-effective way of doing it.
Right. Dr. Bhutani, closing comments?
Yeah, one thing for viewers, again, I would like to tell them that coronavirus and flu are entirely two different illnesses. Yes, if you take, is rightly said in this panel, if you take flu vaccine, you reduce the risk of hospitalization, including COVID-19, if one gets it. So that's the take-home message. And we recommend giving flu shots to everyone, all because I'm into adult medicine, or all healthy adults also. They should be taking flu vaccine, because I don't think so we have any shortage of flu vaccines, because it's easily available in our flu clinics. Anybody who wants it and who can afford it, they should get it.
Right, but be careful about your timing with the COVID vaccine. Be careful
Yes,
about
it should
when
be at
you're
least
getting
2
it.
weeks.
So please do consult your doctor very clearly on this. Last word, Dr. Gilada, to you.
Sonal, all these panelists have said, yes, it is important. But pediatric vaccine dose is actually 0.25 ml, and those doses are not available. So, and one company makes it, but the cost is only 200 rupees less than the adult dose. Secondly, there are no multi-dose available. So, if multi-dose is available, the cost can go down. And everybody has become a totally COVID-centric. All policies are COVID-centric. Now that COVID has increased the importance of vaccine, government also should think how best we can reduce the cost, how best we can produce it in India.
Right.
So,
Dr.
nasal
Manish
vaccine was
is shaking
available
his head. I
3-4
quickly want to
years
see if
back.
he has a rebuttal to that. Dr. Manish?
Yeah, so the dose of pediatric vaccine is not 0.25. Now it's been revised to 0.5. It's
I
0.5
see.
ml from 6 months to 100 years. It's the same dose now. It was 0.25 till about 1 or 2 years ago. But it's been revised now. Now it's 0.5 ml. That's
Right.
one thing.
And single dose for adults or 2 doses for adults?
No, single dose.
Adults is single,
So everybody is a single
single dose. Up to
For
9
single-
years of age, if you're giving the vaccine for the first time, you need to give 2 doses. That's very important. Beyond 9 years, it's single dose. When the first time you give 2 doses. Thereafter, it's a single shot annually. And it's
All
0.5 ml now. Even for a 6 months old, it's 0.5 ml.
Right. All right. So all of you have said a lot of things that we need to absorb about this influenza vaccine. I'm afraid that's all the time we have. For those of you wanting to revise, please go to our YouTube channel and check out this entire episode in detail to really understand. And like I always say, this is just FYI. Do consult your doctor. That's it from now. Bye-bye.